Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry with this week's edition of Dental Health with Dr. C. I'd like to talk to you about a phrase that you've probably heard, a treatment you've heard about, because it's pretty famous, called Invisalign. And it's really a remarkable way to do orthodontics, which, well, when I grew up it was metal mouth and magnet teeth, and now it can actually be done with some clear aligners, we call them. It sort of looks like a bleaching tray, but even clearer, that you can actually wear to work and people won't even be aware that you're there. Now, one of the things I'd like to bring up about this is that it's a remarkable technology. We take some impressions, we send it to the lab, and they construct, using graphic design, a configuration where the teeth move slightly in 2-week intervals over the length of the treatment. Each tooth can move up to 1/4 of a millimeter during these 2-week intervals. So before we even start the case, they actually send me a move-in picture called a CLIN check, and I'd kind of like to show you this briefly and then try to show you how it's going to benefit you. So over here on the screen, what we have is the before picture of this young lady's mouth, and it was kind of crowded. You can see things are a little kind of out of whack, and there's a space over here, and that tooth's rotated out. And this is basically a plan that I in the computer generate to go ahead and make some changes over some period of time. Now in this case, her lower teeth are going to take 8 intervals, which would be about 16 weeks. Her upper is going to be 15 intervals, which is going to be 5 months. But the changes we're trying to affect will all take place. The computer and I design when we have to put these little, they're not orange in the mouth, they're little tooth-colored fillings that we just attach to the side of the tooth if we need to grab it a little bit better. And what this does is give me a motion picture of what's going to occur over some period of time as teeth kind of shift slowly through the plan. So over the entire plan on the upper, if we're going to start back at this spot here where you can see things are definitely out of whack, incrementally we can kind of say, okay, this is what happens each 2 weeks as we go through these little plastic aligners where the teeth are moved slowly into a perfect position. So it's kind of a cool technology, and if you're really into the 3D and the computer capabilities that can assist us in our lives these days, this is a really cool tool, to the point where you could actually come into an office and have this workup done, and you would be able to see exactly what's going to occur, how it's going to look, how long each step's going to take, how quickly you could affect a change. Now, what I really want to bring up here today, just to end this segment, is that Invisalign is just not for people that want pretty teeth. I mean, everybody would like them straighter and things like that, but that's almost an ego-driven thing to a point. Not everybody wants, quote, cosmetic dentistry. But I'll take the case of women. In the Journal of Periodontics in 1999, they estimated that 23% of the women 30 to 54 have advanced gum disease. And it's 40% for anybody 55 to 90. So half the people that are going to be viewing this have a relatively good chance of having some active gum disease in their mouth. The problem when you have crowded teeth and teeth that are misaligned, they're much more difficult to take care of. They're much more difficult to keep the gum tissue healthy. So if my best advice is we want your gums to be healthy because it'll avoid premature births, it won't contribute to gum disease, it doesn't affect diabetes, it's not going to affect your heart, and if that's the goal in my office, is to get you as healthy as possible, then when we start talking about gums, we frequently start talking about Invisalign. So if your teeth are a little bit crooked and you've lost some bone and your dentist and your hygienist have been concerned about that, maybe Invisalign could make things easier for you to live longer. That's this week's segment of Dental Health with Dr. C. Thanks.